While we've learned a lot about the patient who's suffering from Ebola, there are still so many questions about his arrival in North Texas and his early treatment. The city of Dallas says the man moved here from Liberia a week ago, but not much more information has been released. It will be the job of the CDC to track down any people that man has come in contact with since he started showing symptoms of Ebola. Fox 4's Calvert Collins joins us now from Texas Health Presbyterian Hospital with the latest on the patient's condition and the hospital precautions.
Well, Clarice, that patient is in isolation and in intensive care away from all other emergency room and ICU patients. Hospital staff also taking every precaution, wearing layers of gowns and covers to protect themselves from any infected bodily fluids. Now, because of federal privacy laws, the hospital and doctors would not divulge much about the patient's condition, only saying that he is communicating.
There's plenty of opportunity for people to fly over and come to any part of the United States.
In this case, the destination was Dallas. The patient left Liberia on September 19th and arrived in North Texas the next day. He did not show any symptoms for 4 days, then walked into the ER at Presbyterian on Friday, September 26th. Doctors say he did not divulge where he'd been and wasn't specific about his symptoms, so they discharged him with antibiotics. On Sunday, September 28th, he arrived by ambulance at the same ER with staff believing he might be the country's first Ebola patient.
We're caring for this patient because this person came to us for help, and they came to us sick, and it's the right thing to do.
For months, the CDC and Texas Department of State Health have been cautioning doctors and nurses to be on the lookout for Ebola patients and to cover up to keep infection from spreading.
They're wearing water impermeable gowns. In fact, they're wearing 2 of them because the gowns open in the back and it's hard to tie them closed. So they have one gown that's in the back and the other gown tying in the front. They're wearing gloves, they're wearing surgical masks, and they're wearing eye protection. And they're wearing, because the patient did have diarrhea, they're wearing shoe protection as well.
Dr. Goodman even describes a buddy system of sorts where medical staff watch each other through glass to make sure they are following CDC infectious disease guidelines.
We were prepared.
Previous Ebola patients, Fort Worth doctor Kent Brantley and Nancy Wright-Bowl, contracted the virus while working as missionaries in Liberia. Both were flown to Atlanta and given the experimental vaccine ZMapp, which is now depleted. So this patient's treatment is more routine.
The key to treatment is maintaining adequate volume of fluid in the patient's circulation. When they're having symptoms like vomiting or diarrhea, they can lose fluid, and that can lead to damage to organs.
The CDC and Dallas County Health Department are charged with monitoring the patient's family to see if any have symptoms of the virus. Presbyterian Hospital does have capacity for more patients if needed, but so far there are none. The director of the CDC in Atlanta tried to ease people's fears.
I have no doubt that we'll stop this in its tracks in the U.S., but I also have no doubt that as long as the outbreak continues in Africa, we need to be on our guard.
That's why when I asked Dr. Goodman here if he thought that Ebola would be seen in his hospital, he immediately responded that yes, because of all those CDC guidelines and precautions they've been taking over the last few months. Now, any medical worker who came in contact with this patient on Friday when he was treated in the ER is being interviewed, and any that had contact with any kind of blood or bodily fluid will be tested. Otherwise, there would be no exposure. Clarice.
Okay, that's good info about the medical workers, Calvert, but what about the patients who were in the ER on that Friday and Sunday?
Well, the doctor said it would be highly unlikely that they had any contact with this patient just in general because he was pretty much treated, on his own just like any other ER patient. But again, this is not an airborne virus, so that any other ER patients would have had to be close enough to have any kind of bodily fluid contact, whether through vomiting or other blood. So it would be extremely unlikely, although the ER does have a log of all patients who were treated on Friday. So if just as precautionary, they might reach out to some of those patients, but at this point don't think it is necessary.
All right, good information, Calvert. Thank you.